I would like to ask your permission to use this video for educational purpose and an interview because of you. Do I have your permission?
Yes, yes.
Tell me with your words, what were your symptoms? Where was your pain before the surgery?
Depending upon the day, probably 6 to 8, sometimes a 10. Sitting would bother, especially standing for a long time would bother.
How long did you have that pain before the surgery?
17 is when it started.
Yeah, it started in
Very
17.
long time.
So 2 years,
But it
just
was,
about.
Oh, okay, 2 years before the surgery. Okay, now the surgery was about a little more than a year ago.
Yes, yes.
How long did you stay in the hospital?
Just overnight.
So you stayed only over the night in the hospital?
Yes.
When did the leg pain go away?
Almost immediately. I mean, when they got me up later that night to walk, I was amazed how good I could walk that evening after surgery.
Evening after surgery. Now, when did the back pain go away?
Well, that was the same. I had pain from the incision sites, but the back pain that was there before was not anymore.
No, it was a different kind of pain. It's surprising that lots of people actually can tell the difference, but I hear that a lot now. When did you return to basic activities after the surgery? How long did it take you to do basic works at home and cook for yourself and do the basic stuff?
A couple days.
Couple of days, excellent.
Yeah.
Now, I'm going to actually turn around, and you got a big surgery. We call that a fusion and what we call L4, 5S1, and the bone actually beautifully growing. Look at that. Bone is beautifully growing in both levels. And from what you're describing to me, most of your symptoms, or if not all of them, are gone. Is that correct?
Correct.
How is the daily activity these days?
I'm doing everything I want to.
Yes.
I mean, I'm still doing my exercises
And you
quite
should
faithfully.
And you should continue doing them. They are good for you.
Yep. But other than that, I'm doing everything I did before.
Yeah.
So.
May I ask you what you notice in her daily activity, what you observe, how she was before and how before
When
the
you
surgery?
asked how fast she got back to normal activities, the first morning that we were home, I made the bed. And the next morning she helped me, and after that I just quit trying because she was right to making the bed.
And you absolutely beautifully described about how fast our patient get better with this kind of surgery. The recovery after traditional old-fashioned way is significantly longer, way longer than that. But I'm happy that really worked for you. So far, did we deliver what we promised you?
Yes.
Excellent.
Yes.
Excellent.
And physical therapist let me go way earlier than he said he would other people, because he said, you don't need it. I mean, he could tell I was doing mine at home.
Yeah.
So.
And how long were you taking pills for pain after the surgery?
3 or 4 days
Yeah.
probably.
That's
is
it?
about all.
Not really long.
No, not
Well,
too long.
I'm happy we could help.
Well, thank you very
So
much.
thank you for the interview, and thank you for being a patient with us. Okay.
Yes.
Thank you very much.
Thank you.